Hello everyone, this is Dr. Mohsin. Today I'm going to teach you how to do the ankle examination. As every joint examination involves looking, feeling and moving the joint and doing some special tests. We will be covering all these here. So there are 4 to 5 cases that you can get in your exam. It is metatarsalgia, mortals in neuroma, plantar fasciitis, Achilles tendon rupture and ankle sprain. Alright, so before starting the examination, we need to explain the patient what we are going to do. We need to tell him that I am going to look, I am going to feel, I am going to move your joint and doing some special tests. This is procedure. Position would be, patient would be lying on the couch and exposure would be just below the knee. Alright, now we are going to start. First of all, I will ask him to, can you please expose yourself just below the knee. Alright, then I will start inspecting from here, looking for any redness, any swelling, any difference in hair distribution, if there are any kind of skin changes. Then I will look at the nails, looking for any callonekia, leukonekia, any clumping. Then I will let the patient know that I am going to touch you and will parting the toe to look for any fungal infection. Alright. Then I will look at the base of the foot for any ulcer, any hard skin. Alright, so after that I will ask the patient, can you please bend your leg for me? And I will be looking at back of the leg as well. Alright, everything is fine. Alright, so thank you so much. You can just straighten up your leg. After inspection, I am going to feel. I am going to check the tenderness. First of all, doctors, as in every patient part, we always do temperature. So I will warm my hands. I will let the patient know that I am going to touch you and I will be feeling for the temperature of the joints. Around the ankle joint, comparing it with the surrounding, at the fringes, at the metatarsals. Alright. So after checking the temperature, doctors, next thing is now the patient checking for tenderness, any pain. First of all, I am checking for the tenderness at the metatarsals. So I will be squeezing the metatarsals like this, alright, from here, I will be squeezing it, alright, and I will be looking towards the patient's face for any pain. Then I will be palpating with the thumb and index finger for the tarsals, like this, and look towards the patient's face, and checking for tenderness on the malleoli, lateral malleoli, middle malleoli, and on shin as well. Then I will ask the patient to bend his leg. Can you please bend your leg for me? And then I will check for tenderness at the Achilles tendon, at the calcaneum as well. Alright. So we are done with the feeling part, the palpation part. You can straighten your leg. Now doctors, I will be asking him to make few movements. Alright. So first of all, I will ask him to move his foot towards himself. Can you please move your foot towards you? So this is flexion of ankle. Now can you please move your foot towards the floor? So this is extension. Alright, this is extension. Now I will ask him to touch his toes with heels apart. Can you please touch your toes? Now your heels with toes apart. Alright, thank you. Can you please move your fingers towards you? This is flexion of fingers. Now move your fingers towards the floor. It's extension of fingers. Alright, the flinges. Alright, so after that, so I have done with the looking, feeling and the moving part. Now I am going to do some special tests. There are basically 5 tests in ankle examination. That is windlass test, mulder test, squeeze test, anterior dog test and Thompson test. First of all, I will be doing the windlass test. So windlass test is basically for plantar fasciitis. I will be doing the plantar flexion of the big toe. Alright, and patient might be feeling pain at the base of big toe. It means he is having plantar fasciitis because plantar fascia attaches here. So I will be moving the big toe dorsiflexion. I will ask him if you feel any pain here at the base. So this is windlass test for plantar fasciitis. After that, next test is squeeze test. That's for metatarsalgia. I will be simply squeezing the metatarsals like this. Look towards the patient's face for any pain and will be feeling pain at the base of toes. It means he is having positive squeeze test. He is having metatarsalgia. Next test, doctors, is Mulder's test. How to do Mulder's test? That is for Morton's neuroma. I will be simply squeezing his foot like this. So I will be making a concavity at the foot. Alright. So I will be squeezing the foot like this. So there will be a concavity formed here at the sole. I will be forming a concavity like this, and I will be placing my thumb and my index finger in between the third and the fourth toe. Thumb at the sole and index finger on the opposite side, on the dorsal side, I will be applying pressure. If a patient feels any pain, any people-like sensation, any rope-like sensation, any numbness, tingling here, it means this test is positive for motor neuroma. This is mulder's test for motor neuron. Next is anterior draw test. Anterior draw test is basically ankle sprain. We are actually checking the talofibular ligament here. So what I will be doing, I will be simply placing my one hand on shin, second hand here on the heel, and I will be moving it forward towards me. I will be pushing it backward and moving the heel towards me. If there is any pain here, alright, or if there is increased laxity, increased movement, it means this test is positive. Anterior draw test is positive. Alright, so this test is positive for ankle sprain. Last test, that is the Thompson's test. Alright, I will simply ask the patient to kneel on the chair to check for the Achilles tendon rupture. So James, can you please kneel on this chair for me? I need to check the Achilles tendon rupture. Right. So what I will be doing, I will be simply squeezing the calf. And normally there will be plantar flexion. See, there is plantar flexion here. It means Achilles tendon is intact. Right, so doctors, thank you so much. This is all. So we will finish our examination by examining one joint below and one joint above. Thank you so much.